Borderline personality disorder is one of the 10 personality disorders recognized by the American Psychiatric Association. And although it shares some overlapping symptoms to bipolar disorder, the two are different. Dr. Lilianna Yuen is a clinical psychologist with Community and said each diagnosis can be life-changing, but with the right therapy and treatment, patients can live normal lives. There are several main symptoms associated with borderline personality disorder.
One of the main ones is fear of abandonment. Another one is something we call splitting. It's sort of like black and white thinking.
Splitting is a symptom where a patient can think only in polar opposites, where things are either good or bad, and there is no room for in between.
So someone is, maybe a therapist, for example, is like most talented, best therapist in the world, and then they do something, a small thing that the patient doesn't like, and suddenly they're the worst person in the world.
Other symptoms of borderline personality disorder can include self-harm and unstable relationships, as well as fluctuating moods throughout the day.
Usually reacting to something that happened or didn't happen during the day. And then sometimes in extreme cases, you'll see paranoia and dissociation.
Dr. Yuen said many who have been diagnosed with borderline personality disorder have experienced some sort of trauma or abuse in childhood.
So it is generally believed that personality disorders have a little bit more to do with upbringing than genetics compared to some of our other disorders, but probably both are at play.
Bipolar disorder shares some similarities to borderline personality disorder, but there are some differences.
So bipolar disorder is a mood disorder. It has periods of elevated mood.
There can be manic episodes or impulsivity with patients who have been diagnosed with bipolar disorder.
So people are very kind of distractible, jumping from one thing to the next, impulsive. So they often think they're, very special or talented, or that, they are going to be president one day or something like that.
This can lead to a person's thoughts of being erratic and hard to follow.
So if someone, suddenly wants to write a novel, or they, want to produce a movie or something like that, very talkative, something that we call pressured speech, which is when you talk very quickly and it's hard to interrupt you.
The similarities between both disorders, Dr. Yuen said, are depressive episodes. The difference, however, is the length of time that the episode lasts.
Big differentiating factors is just kind of the time length and the severity. So borderline personality, you're going to have mood swings, but it's sort of these ups and downs throughout the day, every day. So frequent shifts. Whereas in bipolar disorder, you're looking at like discrete mood episodes that are lasting like weeks or months.
There are treatments and medications for both.
For borderline personality disorder, I think one of the biggest things you can do is just encourage therapy. So bipolar disorder, generally thought we have different recommendations, about how long you should stay on one medication or another.
And with the right treatment, the patient can live a long and symptom-free life.